Hello, dear friends. My name is Sofya Dorinskaya. I am a doctor and the head of the Center for Medical Information. At our center, we offer programs to eliminate nutrient deficiencies. Today, I believe we are going to discuss a very interesting topic. A topic so interesting, so close to everyone on one hand, yet on the other hand so poorly understood by anyone, that I think after today's talk many people will have their eyes opened. Have you ever seen someone or experienced yourself a state of constant depression? You might not even recognize it as depression. A person might describe it like, well, the years are passing, life is just. You know, youth is gone, here comes another birthday, friends are getting sick. And this person always has a depressive, gloomy background state. Family, children try to cheer them up. A husband gives gifts or a wife. They try to organize some celebration. But no matter what is done, you come into the kitchen and begin. This is all in the wrong place, this wasn't brewed right, these dishes are wrong. Even if everything is fine, the person still finds something wrong. And usually they speak in this exhausting, monotonous voice, saying how bad everything is. And even if your family loves you dearly, they say, enough whining already. We can't take it anymore. And you think, yes, really, what's wrong with me? And you try to pull yourself together, you think, what's with my mood? I should try to lift myself up. You force yourself to smile, watch some movie, push yourself to enjoy it, but still there's this constant background feeling, this sense of doom, persistent hypochondria. You expect some terrible disease. A sting in your heel, cancer. An itch in your eye, cancer. A pimple, cancer. A burp, cancer. Blood and stool from hemorrhoids, cancer. And so it goes constantly. Some people internalize it, others start going to doctors. The doctors look at them, find nothing, and say, you need a psychiatrist. You open your heart to the psychiatrist, say, doctor, I can't anymore, this depression is killing me. And the psychiatrist says, of course, we're here to help. How's your home life? You answer, it's fine. I have a husband, kids, financial stability, a beloved dog, gifts. But still, I just can't anymore. Then the psychiatrist tells you, you have endogenous depression. You're mentally ill, let's say it straight. You're one of those depressive types. Let's treat you. And then come the antidepressants. Or these days, they often use anti-epileptics. Then maybe neuroleptics. Then you start experiencing all the side effects, restlessness, unstable legs. If the doctor isn't totally clueless, they start switching your neuroleptics, realizing they've already pushed you into dyskinesia, and so on. But still your condition doesn't go away. Let me tell you a secret, it won't go away. Because such severe depression, with all the signs of heavy endogenous depression, monotonous, dull speech, constant fear of something bad happening, intense hypochondria. It might ease up occasionally, but even in bright periods the mood is still dark. Antidepressants and neuroleptics will never help you, because such emotional symptoms point to a disease caused by nicotinic acid deficiency. That's right. In pellagra patients you see anxiety, suspicion, mood instability, sudden tears, sadness, worry, self-blame. These days, self-blame might mean thinking you're a bad homemaker or that you owe everyone something. This compulsive making up to others becomes exhausting, even for close relatives. You don't need it, but they keep bringing you things. Or you feel obligated to do things for people even when you don't have to. This isn't just a habit, it's a symptom of serious physical suffering. Always. The facial expression is dull. The dominant mood is depressed, with frequent crying, complaints of sadness, heaviness in the chest, a wish not to live. They speak in a quiet voice and cry during conversations. Attention is weak, easily distracted. Interest is limited to themselves and their illness. Sleep is poor, appetite is poor. Understand? Let's recall my video, The True Disease. Remember I said, if you're treating something and it's not improving, then you're treating the wrong thing. There's something called a true disease. So if you're treating yourself with antidepressants, anti-epileptics, neuroleptics, and all sorts of pharmaceutical nonsense, it will never help. Because the root of this condition is severe nutritional suffering, a specific diet-related disease, nicotinic acid deficiency, along with likely many other vitamin deficiencies. Let's take a look. By the way, pellagra, niacin deficiency, is one of the causes of obesity and swelling. Again, I repeat, if you see an overweight person, don't think of them as someone who lies on the couch eating red caviar. If they actually were eating that much caviar, they'd be slim, happy, and healthy. People in this depressive state suffer from severe depression. Nothing brings them joy. Not shopping, not prosperity, not vacations. You can give them anything, take them anywhere. Even if they seem normal and smile if you ask, they will always describe a heavy, unexplained pain in the heart, an expectation that something bad is coming. That's a symptom, not a personality trait. These people often start denying themselves food. And of course, in their fear of cancer, which is a big obsession for them, they begin to read websites and immediately find, stop eating meat. And so they do. If you do that, you'll be fast-tracked to cancer. Never give up meat. Especially if you're mentally unwell, you need to increase your meat intake. So where is niacin most abundant? Lamb, 4 milligrams per 100 grams. Beef, up to 6.4 milligrams. Beef liver, 12 milligrams. Beef brains, 3.5 to 4.9 milligrams. Calf kidneys, 9.8 milligrams. Pork, 6 milligrams. Salmon, 6 to 6.4 milligrams. Veal, 7 milligrams. And now the nonsense. Dairy products don't even hit 1 milligram. Dry cow's milk has 0.8 milligrams. Fruits and berries, peanuts. Grapefruit, 0.2 milligrams. Cranberry, 0.13 milligrams. Vegetables, carrots, 1.5 milligrams at best. Grains, wheat germ, up to 4.2 milligrams. But how much can you realistically eat? 100 grams of wheat germ gives you only 4.2 milligrams of niacin. Legumes, traces. Dried lentils, 3.1 milligram. And that's dried weight. Baker's yeast, 11 to 60 milligrams per 100 grams. Yes, yeast is excellent. Niacin is a B vitamin, and yeast contains the whole B complex. So this is what I want to tell you. So what causes niacin deficiency? It's very interesting. I once read a post and there a girl describes her friend. And she directly describes a scurvy clinic. That's how she describes it. And so this poor thing has already been to one doctor, then a second, then a third, then a 15th, and nothing happens. To be honest, I never tell anyone on social networks anymore because there's such a fuss as if I said something terrible. But then I wrote a comment that your friend has scurvy, to which she rolled out such a cart to me. What is this, my friend? She's such a wealthy lady. She earns so much. What scurvy? To which I wrote, well, if you think diagnoses are in a person's wallet, then of course, then it can't be. The presence or absence of certain specific nutritional diseases in a person does not correlate with their money at all. Unfortunately, in the modern world. No, it is clear that if we took, for example, the Middle Ages, then, of course, a beggar who lives on the street, who has no shoes and who simply walks down the street in a snowstorm, and a person who lives in warmth and eats well, and he has money for meat. Of course, this is obvious. But now people with very large sums of money. I, to be honest, will not even say who, but I know, even visually I know one person from one of the royal families on the planet, who suffers from the most severe pellagra. And judging by the fact that this person appears with it and appears, his doctors have never heard of it. Oh well. So this is how a person can get a niacin deficiency. First, it might simply not be enough in the diet. Even meat eaters may not get enough to correct a deficiency once it develops. And once there's a deficiency, diet alone isn't enough to fix it. Second, diarrhea. It used to be common medical wisdom, if diarrhea lasts more than 2 days, whatever the reason, weight loss meds, food poisoning, etc., then pellagra is coming. Third, low stomach acidity, lack of hydrochloric acid or pepsin. Shout out to all the doctors giving lifelong antacids to patients. That's a one-way ticket to the grave. Yes, sometimes you need an antacid short-term, but long-term use leads straight to niacin deficiency and vitamin C deficiency. Even if you take them as supplements, it won't help much. Fourth, any inflammatory GI disease leads to niacin deficiency, and niacin deficiency causes GI inflammation. It's a vicious circle. How to break this cycle? You must contact me, Sofya Dorinskaya, on Dorinskaya.com, request a test, and start our deficiency correction program. We help people get out of this state. We build special plans to gradually introduce them into recovery and break the vicious cycle. Another cause, alcohol. Wealthy people don't deny themselves alcohol. There's nothing wrong with that. Fine alcohol is one of life's pleasures, but you must understand the biological toll and how to manage the side effects. Again, if you notice you're drawn to alcohol, it's time for our program. That's a major warning bell, because if you don't understand these mechanisms, you'll treat the wrong problems forever and never fix them. Again, a true disease is one that disappears when you address the real cause. If it doesn't go away, you're not treating the right thing. You can spend your life treating the wrong issue, and it'll bury you. So, friends, I invite you to our deficiency correction program. It's always cheaper than trying to fix a crisis after it develops, because once full-blown disease sets in, you'll need many specialists. Even if vitamin deficiency is the root, the secondary issues will still need treatment. And the vitamin base remains and continues to mess with your health. It becomes a huge tangled mess. So don't let things get that far financially, emotionally, or physically. Prepare in advance. I invite you to our deficiency correction program. Go to Dorinskaya.com. You'll see 2 buttons, Test for Adults and Test for Children. Click the one that fits, fill out the order form, and we'll begin the program. All the best. Goodbye.